So this is my newborn assessment. This is my baby. So I would start the newborn assessment by first performing hand hygiene and then knocking on the door and coming in to introduce myself to the parents. So I would say, hi, my name is Brianna. I'm going to be a nurse for today. Then I would ask them to verify the baby's name and date of birth for me. So the baby's name is Isabel Jones. She was born 2/14. 21. So then I'll just verify the information the parents gave me with her little name band, make sure everything matches. Then I would ask them if it's okay for me to perform a newborn assessment on the baby, and hopefully they say yes. And I say, okay, thanks. And then after that, I would ensure that the privacy is set up. So I would close the door or close the curtain. And if there's people in the room that the parents are comfortable with having in the room while I do the newborn assessment, I would just simply ask them to step outside while I perform the assessment, and then they can come back in when the assessment is done. So the first thing I would do is I would start with taking vitals for the baby. So I would start the heart rate. So the heart rate would be 130. The blood pressure would be 60 over. It could be like 60 over 50. And then so blood pressure, heart rate, and then the temperature would be 99.7 rectal. And then the respirations, it would be at 50. So those are all within the normal vital signs that I would make sure as I'm going through the steps I explain to the parents what I'm doing. Then I would listen for their heart and lung sounds. So I would listen with the bell of my stethoscope, and I would just listen out for the baby's heart, make sure that there's no if it's just like heart sounds, like make sure that everything sounds okay, make sure there's an S1, S2, noting if there is a murmur or galloping sound, and then I would listen to their lungs, and then I would listen to their lungs on the back as well. And then over listen to their lung sounds on the back. Again, making sure that I'm not hearing any adventitious breath sounds, making sure that as they're breathing, making sure there's no flaring of their nostrils as they're breathing, making sure there's no retractions as they're breathing, because those are signs of a hard effort to breathe, and that means that they have something wrong. Make sure there's no fluids or anything like that in their lungs. So once I do their once I do their lung sounds on both sides, and I do their heart rate, I listen to the heart. Then I would check their skin just to make sure everything's okay. So in a normal baby, I would check for their skin to make sure that there's no, just make sure there's no weird skin findings, like anything abnormal. So I always make sure that there's no skin tags on them. I would make sure that they're still not blue, because that's a sign that they're not breathing properly and they need quick intervention. That means they're not getting enough oxygen. I would want the baby to be pink and have color. If the baby has a stork bite, that's normal. If the baby has the milia, that's normal as well. And if they also have little rash, little red spots, that's normal as well, because that's the broken blood vessels. And I'll make sure to tell that to the parents as well, so they're not freaking out. And then while I'm looking at their skin, I just want to look at their hands as well, just make sure that their feet, their hands and toes have all five on each fingers, 5 on each set. So it's 10 toes, 10 fingers. Make sure there's no webbing in between. I also want to check their back to make sure that there's no abnormalities with their clavicles, and there's no weird hair growing on their scalpel. I just want to make sure everything is even, symmetrical. Same with their face. You want to make sure that their face is symmetrical. You want to make sure that there's no asymmetric, it's not asymmetric. You want to make sure everything's even. You want to make sure that their eyes and their ears are lined up. If not, that's a sign for Down syndrome. You want to make sure that eyes and ears lined up. You want to make sure that they're not make sure that everything is just, yeah, everything's even. And then after that, you would test like their, just like test their strength. You'll have them grip you. That's part of the palm or grasp. So that's one of the reflexes. So you want to make sure that it's strong on both sides, like on both in both hands. After that, you would take a gloved hand. You would put it in their mouth so they can initiate like the suckling reflex. So you want to make sure that they're doing that. They're able to do that. And you also want to check for like a cleft palate. And you can also see if they have a cleft palate, but you want to check to make sure. And then after that, you would measure their head and chest. So you would get a little tape measure. You measure their head, and a normal head circumference is 35 centimeters. And then the same with their chest. The chest circumference is of 30 is normal. And then you would measure their length. So, like lay them down like that and measure their length. And a length of 50 centimeters is normal as well in a baby. So that's full term. And then after that, you just want to check, you want to listen to their stomachs before you palpate it. So you want to listen in all 4 quadrants. You want to make sure you hear bowel noises in each quadrant. And then after that, and if not, you would wait. You would wait till you hear them. And then after that, you would want to palpate their stomach, make sure that it's soft, it's tender, make sure that it's round. You don't want it to be hard. You want to make sure that they're not responding in any type of pain, like it's not causing any pain for them. Then you want to check the umbilical cord as well. You want to make sure that it's dry, it's intact, it's not affected, it doesn't have this odor to it. So once you do all of that, and then oh, I forgot. So in the back, you also want to, when you listen to their lung sounds in the back, you also want to make sure that their spine is not curved. Like there's no curvature of the spine. Like everything is just there's no curvature of the spine. Everything is as it should be. And so that was and then after that, you would do you could do the reflexes. So you can do the startle reflex. You can do the Babinski reflex with your finger going like that to their foot. You would also do the stepping reflex where you lift them and then they try to step. You would do the plantar grasp where if you put your hand, like a finger underneath their toes and they try to grasp it. You would also check for hip dysplasia. So you would do the Barlow maneuver as well as the Ontani maneuver. Sorry, I don't know how to pronounce that one. But you would just make sure, you would just like move their legs like that and then like around and if you hear a popping sound, that means that they do have hip dysplasia. And then you would also want to take a pulse. You would do a femoral pulse, and you would do a femoral pulse, and you would just make sure that it's even on both sides, like at least like a +2, so it's not faint and it's not too pounding. After that, you also would check the creases. So like you would check like their thighs to make sure like their thigh creases to make sure that that's symmetrical as well. You would also check for their genitalia. So if it's a boy, you want to make sure that the testes are descending. In both genders, it's perfectly normal for the baby to be swollen and red down there. For a girl, the labia will be really swollen, really red, which is normal, and there would be like a blood tinge or like a light pink tinge, a light pink discharge coming from them for a few days. That's normal for a girl. It's nothing to be concerned about. And then after that, yeah, you just want to check to make sure that all their pulses are good. So like I said, their femoral pulse is good. You can check brachial pulse as well. The femoral pulse would be more accurate for a baby. You want to make sure, again, there's no skin tags, no extra fingers. And it wouldn't be like an extra like finger like this. Like it would just be like a little bump, like a little bump attached to like one of their fingers, and you can just tie that off and let it fall off on its own if they have that. And baby's okay. And then, oh, you would also do the INO. So you would measure the baby's, you would, for all the, like, wet diapers. So for a baby, it's supposed to be 6 to 7 wet diapers a day. That's how you know the baby's, like, eating and, like, everything's working down there. They're not having trouble going. You would measure it on a scale. And, you could also measure it on the scale. For stool, after 24 hours after birth, the baby has their first stool. It's the menocal. I can't pronounce that, but it's the stool that's it's the black, the greenish black tarry stool. It's like thick. It's sticky. You would make sure they have that after the first 24 hours. If not, then you would. If not, then you would just monitor that. And after that, the assessment is done. So then I would ask the parents if they have any more questions or any concerns. And then if they say no, and I would just let them know that their baby was fine, everything was within normal range, there's nothing abnormal. And I would also just ask the parents, like, how often. I guess I would ask the parents how often they would the baby's eating, and making sure the baby's latching on correctly if it's being breastfed. And that was my newborn assessment with my baby.